Hi, my name is Hermine and I'm part of NietHersteld, which means not recovered in Dutch. NietHersteld is a Dutch activist patient collective that we started in March 2023. I was infected with COVID at the beginning of the pandemic, and that resulted in long COVID. So I've been sick for almost 5 years now.
And I am Guus. I have long COVID since 2021. And as part of my long COVID, I also have dysautonomia, MCAS, and I meet the criteria of ME/CFS. The aim of NietHersteld is to form a strong community of patients and to make the voices heard of all patients with a post acute infectious syndrome, a PAIS. And in this talk, we will use the acronym PAIS because this is the one we use the most in the Netherlands, and it can be seen as sort of an equivalent of the term IACC, which stands for infection associated chronic conditions.
Yes, as Guus just said, we want to amplify the voices of all patients with a PAIS, especially those patients that are often overlooked or not represented properly when it comes to things like medical research and health protocols. Inclusion and accessibility are very important aspects of our activism.
And to give an example of what we have done as NietHersteld, I will mention a few things that we have done so far. We've started a photo campaign on our social media to quite literally show the disappearance of patients from their lives with pictures. And those pictures were accompanied by a short text that people wrote themselves. We have also talked to members of parliament, and we have been involved in several other campaigns, usually working together with other patient organizations to spread a message about long COVID and similar diseases to the wider public, politicians, and the media. And we've also been making a podcast, mainly because we were looking for a way to connect and interact with the community of patients.
As NietHersteld, we want to be there for all patients with these types of diseases. And as we said at the beginning, one of our aims as NietHersteld is to amplify the voices of patients that are often not heard and not seen, and do not receive proper attention when it comes to research, care, the media, and political policies. The first group that we would like to mention are the patients who fall into the severe and very severe categories. In other words, the patients who are the sickest. These are the patients who have often completely disappeared from society, spending all of their time at home, often in bed all day in a dark room. Their quality of life is low, their suffering is enormous, so you'd think that they are a logical group to pay attention to. But their disappearance from society has often also meant an exclusion from research, from care protocols, from clinical trials, and from political policies. The seriousness of their illnesses also means that it is impossible for these patients to stand up for themselves. The burden of their suffering seems hard to grasp, not just for able-bodied people, but also for people inside the PAIS community. It almost looks too extreme to be real, but unfortunately, many people live this absolute nightmare every day, and a lot of them have done for years or even literal decades.
Another group of people that we try to give more attention to are people with a PAIS outside of the long COVID group. In the Netherlands, time and time again, they have not received the care they deserved. And the history of how we treated people with, for example, ME/CFS is very bleak. It's full of medical neglect, gaslighting, and harmful treatment. And this has been going on for decades. Now and then, this group might be mentioned in the context of long COVID research or of long COVID clinics, in the sense that they might benefit from it in the future. But in most cases, they are not included yet in a real practical sense. And it seems very unlikely that they will be in the near future. So they are really last in line. This is very problematic because so much knowledge, for example, in the context of patient communities, has been provided by patients with ME. And they were the first to warn people on social media when the pandemic hit to be careful with the possible long-term effects of COVID. And they knew that there would probably be a group that would become chronically ill. We have learned so much from them, but they've almost never been able to really benefit from the extra attention and influx of money that long COVID has received. And this is not only unfair, if you look at the very long history of horrible treatments and neglect of these patient groups, it's also quite ignorant considering the amount of knowledge and experience they bring to the table. Because it's knowledge derived from literature on these conditions that is now being used in research and care settings for long COVID. So when we mention that they might benefit from it in the future, we should realize that it's actually more the other way around. We have been benefiting from all the knowledge these diseases and patients' communities have given us. This is why we always try to include all the different PAIS in our activism, because we believe that you can't talk about long COVID without talking about the other PAIS as well. And to give a concrete example of this, in one of our first episodes of our podcast, we delved into the history of Dutch health policies for chronic Lyme disease, for ME, and for QFS, which is the post-infectious disease caused by Q fever, of which we had an epidemic in the Netherlands in 2007. And in that episode, we focus particularly on how specialized clinics for these diseases functioned. Spoiler alert, not great, if they even existed.
A third group we would like to mention are children with a PAIS. Time and time again, this group is overlooked, and a lot of people, both inside and outside of healthcare settings, do not even know or believe that children can get sick with these types of diseases. This is a huge problem because unfortunately, children do get sick. And just like for adults, there is not a lot of help or care available for children. And this is an extra sort of painful if you think about how incredibly important and influential these years are in a person's life.
We have said that accessibility and inclusion are very important to us. And we try not just to say that, but also to practice what we preach by including different types of patient groups in what we do, such as in the photo campaign, the podcast, and in our talks with politicians. But accessibility and inclusion are also important to us in the way we do these things. To give an example of how we try to work on accessibility, we've decided to make our podcast as boring as possible when it comes to the audio, because we know that many patients have sensory issues. We also pay a lot of attention to the subtitling of videos and to make a good transcript of our podcast episodes. And when we do an email campaign, we make sure that there is an example email and a low spoon version as well for people that don't have the ability to write something themselves, so they can still be included.
And another way of thinking about inclusion and accessibility is to be very aware of what it means for the patient in our community to join a campaign that we organize. Sending in a picture for our photo campaign, for example, might seem like a relatively small action for an able-bodied person. But for many patients, especially the ones in the severe and very severe categories, finding a picture, writing down a text that accompanies that picture, and sending both of those things in is actually incredibly hard and can lead to a worsening of symptoms. That is why we always think about the question, is what we ask of our community worth it, in the sense of how much attention it will get or how effective it will be on the one hand, and what it will cost the members of our community on the other hand.
And this question, is it worth it, is also something that we have to ask ourselves, because we are ill as well. And almost all the things that we do as NietHersteld are influenced by our own physical and cognitive limitations. And I think the podcast is a good example of this, because we have so many things that we still like to discuss on the podcast. But the last episode that we have recorded was in August, because I haven't been well enough since then to be able to make a new episode.
Because of our physical limitations, almost all of our activities are online. On the one hand, it's a great way to reach a lot of people, also many of whom are too ill to participate in society and whose main contact with the outside world is through social media. On the other hand, though, having to limit our activities to the online world means we can be ignored much too easily by politicians and the media. You will rarely see us in physical spaces, and that is a problem when it comes to visibility. If we could, we would set up protests, we would chain ourselves to fences, we would be in people's faces all the time so that they can no longer ignore us.
But we can't, and the only way we could ever do this is if we had able-bodied allies. And what we have experienced this far is that in the end it always comes down to a gap between the world that we live in as patients and the other world, the world of the able-bodied, which is also the world where policymakers, researchers, and journalists are. And we are simply too sick to bridge the gap between those worlds on our own. So we need the solidarity and efforts of people from that world as well. We need people from the other world to do their part. And unfortunately, it doesn't happen that often that able bodied people understand this and also act on it and act on it accordingly. I think actor and activist Matt McCrory recently said this very strongly. He said, empathy is not enough without the action of solidarity. So this is also something that we try to put energy towards, finding allies and finding ways to call on solidarity. We've lately been having some interesting meetings about this, but I think that this still is one of the biggest struggles, finding ways to reach the other side, to bridge the gap, and with that also becoming more visible in society.
So, that is our most important message. Don't let us bridge that gap between those worlds on our own. Help us to do that. So many patient voices are not being heard and not being taken seriously right now. And we have to be honest, we don't have all the answers either. Just because we are ill does not mean we know about all the different patient experiences.
So we have been asking ourselves questions as well. We want to amplify the voices of people who are often not heard. But are we always the right people to do that? Do we know enough? Have we included enough perspectives? Are there any gaps in our knowledge?
And of course, the answer is yes, yes, there are gaps in our knowledge. We don't know the perspectives of all patient groups. For example, we know that there is a heavy burden of illness on communities of color. We are white women and we are therefore not in a position to tell others what patients from those groups need and want. But what we can do and what we want to do more is to include and amplify voices from groups like those. This is something that we want to do better. We want to reach out more often to groups we don't know that well yet.
So there is a lot of learning that we as activists still want to do ourselves, and we like to invite you to do the same. A lot starts simply with this. Stop thinking that you already know what we need and be open and be curious. Whether you're a doctor, a researcher, a policymaker, a journalist, even if you worked with patients for a long time, you are human and so you will have knowledge gaps. You will have made assumptions that were wrong.
Ask yourself and your colleagues questions such as, are there patient groups that I don't know much about? And what does that mean for the work I do, the research project that I'm working on, and the newspaper article that I'm writing? Even when you're a patient representative, ask yourself these questions. Be aware of who you can and who you cannot represent. Be curious, find ways to know better and do better. First and foremost, by talking to patients. And yes, also the patients that you don't normally see. For example, the children or the ones who spend most of their days in a dark room. Don't stop after talking to one patient, but keep talking, or better yet, keep listening.
When we only see some of the patient groups, we also see only part of the illness. And to have a more accurate and deeper understanding of these illnesses, we need to see and hear all the patients. So much is still untold, and so many voices are still unheard. As Ed Young, the science journalist and Pulitzer winner, has written in one of his articles, nothing about long COVID or ME/CFS makes sense except in the light of the patient experience.
So make that step towards a better grasp of these illnesses by making an effort to see different patient groups. Try to get a more complete picture. Do your part in bridging the gap. When you do that, when you make that effort, you'll become a better journalist, a better patient representative, a better researcher, academic, policymaker, doctor. But more importantly, you can make a very real difference in the lives of a lot of people. Don't just mind the gap, bridge it.
So that was what we wanted to share with you today. Thank you so much for listening. And if you want to know more about what we do, you can find us on our social media, which is @NietHersteld on most platforms.